in this next section, I'm going to show how to give ear medication and eye medication. I'm going to start with ear medication. One that's commonly prescribed is Panalog. It's a very liquidy medication that comes in this metal tube that we use to treat ear infections in cats. And my favorite way, again, to hold my patients is kind of this maneuver. I have my medication, ready to go. I'm going to take the tip and I'm going to put it in the ear canal, and I'm going to put it actually in where I can see where that little hole is. Because if I just put it on the surface, it's not going to do a whole lot. I want it to get down in that ear canal. So I'm going to squeeze at the very, very tip of this tube because it's metal, and if you squeeze way down here, it tends to squirt everywhere. So I'm going to take Sherbert's ear here and squeeze at the very tip. That's why it's got this little pointy thing on there. And I'm just going to go in, give that little squeeze, and then I'm just going to wipe this little extra on there and then give it a little massage. And then if he needed both ears, I would treat the other ear as well. But really the trick to that is getting that little tip down in. We can look on this side too. I don't know if it helps. There's a little dark ear canal in there, and we want to get the medication down in there to really treat that infection. And then for eye medication, pets do better with drops than ointment. I don't have any drops on me at the time, so I'm going to use ointment. So he might get a little upset with me, but the concept is the same. Gravity is our friend, so I'm going to hold him this way. I'm going to tilt his head up, and I'm going to use whichever eye I'm trying to treat. I'm going to use my middle finger to kind of pull that eyelid down. So I have his nose pointed up and his eyelid pointed down, and if this was eye drops, I would just drop it in and be done. Or I'm going to just squeeze the tiniest bit onto his eyelid, and yeah, that little reaction there is usually what you get when you do ointment. It startles them a little bit because it can look a little cloudy at first, which is why we tend to use eye drops over eye ointment. But really that tilting the head up and pulling that eyelid down, I can kind of show you on this side, like this, and then using your eye drop and going in is really the easiest thing. And then you just let it be. You don't want to touch the eye, you don't want to rub it, you just want to let it be, and it will absorb as needed and kind of go from there. Thanks for watching all the parts to the series, and stay tuned for more.